Hi, my name is Ashley Marks. I'm one of the partners here at Hankey Marks Crider. It is certainly possible to be approved for your disability benefits because of the condition of depression. There are a few things, though, if that's what you're struggling with, that I'd like you to keep in mind. First, Social Security is not just a diagnosis-driven program. So having that diagnosis alone is not a guarantee that you would be approved. Social Security is more focused on the symptoms that the condition is causing the individual. So if the depression symptoms are interfering with typical activities of daily living and therefore interfering with someone's ability to complete full-time competitive employment. If you are struggling with depression, one thing that we do recommend is that you are treating with mental health specialists. So if you're only seeing a primary care doctor, or if you are seeing a mental health specialist, but they have not added like a talk-based therapy, then those are the types of things we would suggest that an individual pursue with their doctors to see if that would be a good idea for them to add to their treatment regimen. A lot of times those more specialty treatment notes, and especially like from a therapist where you're often meeting with them weekly, bi-weekly, once a month, those treatment notes really do give a lot of insight into the struggles that someone with depression has been facing over time. So when you present that to the judge along with your eventual testimony, all that really strengthens the case for, again, what you're struggling with when it comes to those activities of daily living. And therefore, we make that legal argument that that translates into why those struggles would be present if someone did try to work. Also, just the frequency of those treatment visits alone can be used as evidence about why someone would not be able to be at work enough, that they would suffer too many absences because of the treatment and eventually be terminated. If you are struggling with depression or a loved one and you have any other questions about whether filing for disability is an appropriate course of action for you, we would love to talk with you more about that. Our consultations, they can be conducted remotely if that's easier for you, and our consultations are always free.